loads of women, getting cosmetic procedures like Botox or lip fillers is now as normal as the monthly wax, while social media is creating selfie dysphoria, seeing increasing numbers of young girls flocking to the aesthetician. Well, one person who knows all about that is glamour model Katie Price. She was just 18 when she first went under the knife. Now she's training to learn how to give Botox and fillers to others. But surely injecting stuff into someone's face probably shouldn't be administered by someone who doesn't seem to have a plastic surgery stop button and plants her car upside down in a bush after a drugs and booze binge. Well, I'm joined now by consultant ophthalmic and oculoplastic surgeon Elizabeth Hawkes, who professionally practices advanced facial aesthetics. Fantastic to have you on, Elizabeth. Now, I understand that, you can train to administer Botox, but you need a medical practitioner with you. But with fillers, anyone can take a course and do it. Do you think that's a good idea?
Yeah, thank you so much for having me. So you're absolutely correct. In the UK, anyone can administer dermal filler. So it's not illegal. You don't need a medical degree or a qualification. Anyone can go and purchase the fillers over the counter. Botox, however, is classified as a medical drug. And so for that reason, you can only access it if you have a medical license. So if you're a doctor, surgeon, dentist, nurse with prescribing rights, or even a pharmacist.
I mean, I can see there are potentially dangers if anybody who, isn't necessarily trained in medicine or aesthetics starts doling out fillers and the like, especially because you might end up looking like the lion from the Wizard of Oz. But are some of these procedures actually dangerous? Could you inflict serious and lasting damage on someone if you get this wrong?
Yeah, you can. So it's absolutely terrifying from my perspective. So my background is I'm a surgeon and I operate in the face. I'm an eyelid plastic surgeon. So I have a very strong, knowledge on anatomy. However, it's terrifying that people who think they have lots of filler and Botox and your injector makes it look easy would then go on to learn it because, the sort of one end of the spectrum of risks are infection, bruising and discomfort. But then at the other end of the spectrum, by occluding a blood vessel, and probably the most severe end of the spectrum is actually blindness. And if this complication isn't firstly recognised early and treated promptly, it can be irreversible. So it's terrifying to think that anyone can just do this by watching a video. And actually, during some of the pandemics when aesthetic treatments were not being offered by practitioners as it wasn't a priority, there was a real spike in non-medical professionals actually watching a video on YouTube and then injecting themselves at home. And we did see a surge of complications. And in my practice, there was a high rate of patients coming to have filler dissolved.
Wow. So, I was actually going to ask you, have you ever had to patch up other people's botched jobs?
Well, I definitely have. I mean, there's a lot of excellent injectors out there, from surgeons, doctors, nurse practitioners, dentists, like I said, and most of us have a medical qualification, have done a course and are registered with some society. So that's a good way you can do your investigation when choosing a practitioner. But absolutely, a big part of my practice, is, particularly as I specialise in the eye area, is botched filler, as it were. So filler is essentially a gel, and it's made of hyaluronic acid, which is a naturally occurring substance that's in our skin. But how filler works is it's chemically manipulated in order to add volume and last longer. So you have to know exactly where you're injecting it and injecting the right type of filler for the right place. So very commonly, patients would either say they have lumps where they shouldn't be, which need to be dissolved, or botched jobs. For example, if someone has had filler and lost sort of a sense of what's a natural looking appearance of the face, and they want to perhaps reverse some of the filler that they've had in their lips or in their cheeks or somewhere on the body.
Elizabeth, thank you so much for coming on and warning us all of the dangers of potentially getting things injected in your face by people who might not 100% know what they're doing.